And the next speaker is Jean-Paul. Jean-Paul speak about his experience with the WALANT surgery. Focus the Dupuytren.
Thank you. Can you hear me? Hello? Okay. Hello? Okay. I'm going to start with a question. What's the difference between Dupuytren's disease and your ex? Boyfriend, girlfriend, husband, wife, whatever. Anybody knows? The ex will eventually go away. So Dupuytren's disease will come back. And so you're starting a long-term relationship with your patient if you're nice to them, and that brings a subject that's dear to me, and that's patient experience. So what I want to talk about is not just surgery and all that stuff, but also how throughout the surgical experience we make our patients feel, because healing begins in the mind and the heart, not just the hand. So I don't have any, well, I do have disclosures actually. Number one, I'm conflicted because I am Belgian and Canadian. So that's a little confusion that I have, and I don't know which to choose. But so I basically am home always, whether I'm here or there. My second disclosure is that I love patient experience so much that I wrote 2 books about it. Those books are for you to buy on Amazon. And the reason I wrote them is to make you happier, have a better practice, and make your patients happier. But the money goes to the Welcome Hall Mission, which is an organization that fights hunger and homelessness in Montreal. So please buy the books because you're going to benefit, your patients will be benefiting too, and you'll be helping people who need to eat. So, what is WALANT? Well, you know what it is, but it stands for a lot more than just wide-awake local anesthesia and tourniquet surgery. It means no sedation, no IV, no vital sign monitoring, no blood pressure, cuffs, no preoperative clearance. It's basically like going to the dentist, but for your hand surgery. Patient walks in, literally, has their hand fixed and walks out. So they're awake, they're engaged, and they're calm. So basically, WALANT turns a rather passive experience into a human collaborative experience. And I think it replaces confusion that I mentioned earlier with clarity and a sense of connection and confidence and trust. And I think the I think the Dupuytren's surgical experience can be rethought, and I think it should be. Because fear starts way before the operating room, it starts in the waiting room. And then what we do to our patients is we fast them, we hook them to monitors, and we flood them with fear, uncertainty, anxiety before we make a single cut. And I think we can do this better, and we can do it better with WALANT. They can be awake, involved, and at peace. And I'm going to show you that. I think we can do a lot better as surgeons to inspire trust in our patients by how nice we are to them. As you know, Dupuytren's impacts hand function, independence, but even identity. Because much like you are a diabetic patient, you are a Dupuytren patient, and that's an identity. And those patients really have a shift in their identity when they're diagnosed. Yet traditional surgery, meaning sedation, long recovery, and very little patient input, it's quite a passive experience. I think WALANT changes all of that. Like I said, patients are awake, they move, and they are actively participating in the surgery. We correct in real time, but they leave empowered. So I think it's a surgery that's designed around the person and not just the disease. And I think that's important that we remember that we're treating people, not a disease. Montreal is, for me, where it came together, because even if I earned my stripes here in Brussels and in Belgium, and I'm grateful for it, Exception MD was born in Montreal, and Exception MD is the only Canadian WALANT hand surgery center. So 100% of our surgeries are done under wide-awake local anesthesia and no tourniquet, and anesthesiologists are strictly forbidden on the premises. They're not allowed in. But more than just a surgical space, it's a healing space where I wanted patients to feel safe, respected, and human. And now after having operated on more than 5,000 patients at that center, I've learned a couple of things. And one of them is that comfort does not come from sedation. It really comes from compassion and trust. Don Lalonde talked about, asking patients how much pain they feel when you inject them with WALANT. And so we did a study actually looking at that specifically in 3 different countries, actually 3 continents. And we asked patients while they were receiving WALANT anesthesia, how many times they felt a poke or pain. And we enrolled 150 patients prospectively. And guess what? 99% of those patients felt either 0 pain, not even with the first poke, because we use a 30-gauge needle and all distracting techniques, or just 1 pain event, which means a hole-in-one. So if you play golf and you hit a hole-in-one, that's considered exceptional. And so 99% of our patients achieved exceptional scores. And it's not by chance, it's by design, and you can learn to do that just by refining the technique, getting real-time feedback from your patient, because what you don't measure, you can't manage, so you can't get them better. And so I think that's a new standard, and we're going to hear a lot more about it. So it's not just about avoiding pain, it's really about building trust, because if you hurt a patient, you're losing their trust. Even if you tell them ahead of time you're going to hurt them. So when patient arrives at Exception MD, they've eaten, they're not fasted, they're not feeling weak, they're not nauseous, no IV, no paper gown, they're wearing scrubs, they're not showing their behinds to people they don't want to. And they're greeted with, patient-selected music, nice scents, lavender, and we like to mark their hand with a little smiley face. Not for show, but just to tell them, we care about you. And we want you to have a fun experience. Because yes, surgery can be fun. I know it's fun for us, but it can be fun for patients too, believe me. So the healing begins, I think, when you create that environment, that space, not with the incision, but as soon as they take their first breath of relief. So this gives you a little video of what the operating room looks like with music and a light show. And yes, it's possible to create a magic kingdom in which you do surgery. Why not? So this is the patient's perspective. I don't know if you're going to have sound. Oh, yeah. So this is the patient's perspective during surgery. So they're having a great time, and so am I. So remember also that when you're operating on a wide-awake patient, words are like surgical tools. They can harm or they can help. So you got to be careful what you say. Don't say stuff like, oops, or like, big poke, or I'm going to hurt you now, or it's bleeding, or oh my God. Don't say stuff like that. Instead say, tiny pinch, or we're doing great, or you say, oh, that's interesting, or say, almost done, stuff like that. Because the brain doesn't separate emotional pain from physical pain. So, remember, trust starts with language, so be careful with your words. Speak not just to the body, but to the person inside of it. So, what if the experience itself was the treatment? This is another paper that was published in 25. This is global access, open access, so it's free for you to access and download and do whatever you want with. It's a paper that shows that with small changes like tone, language, setting, you create big shifts in outcomes. When patients feel respected and involved, they heal better. Because what happens around the incision is part of the treatment itself. Real-time surgical feedback is really where WALANT changes everything, because the patient moves, you adjust in real time. You don't have to hope that you've released enough. You see it, the patients see it, they move, they experience it. It's not just efficient, it's transformational. So, and this is even more true in recurrent cases, because surgery is a little bit more complex, and you want to remove all that you can without harming, but you want to fine-tune your surgery. I don't know what happened here. Anyways, your patient becomes your guide. And So talking about outcomes, I'm going to show you the first video is one of my patients. And then the second video, so that you can see them moving, and you can show that to the patient. They're super happy. And the second video is from France, from Nantes, Dr. Dupuytren heart. So they get to see the result right away. They don't have to hope it worked. They can see it. Then this video here is from Malaysia.
Make a fist. Straighten your fingers. Okay, now, can you show to the video? Okay, now. Straighten your fingers. Straighten your fingers. Like this. As straight as possible. Very good.
So you can see it's not experimental. It's a movement. It's going abroad and wide, and I think it's a new standard, as I said. Remember that Dupuytren's is not just about the palm. There's also involvement of the back of the hand, and you can get complex deformities like Boutonniere and all sorts of weird stuff. And WALANT allows you to correct both sides, palmar, volar, and dorsal, obviously. You can really fine-tune the correction of those deformities. And I want to show you, this is another paper published in 2025 that focuses on exactly that, the dorsal aspect of Dupuytren's disease. So if you like this, you can scan that and read it later tonight when you're sitting on the toilet or doing something else, whatever. You have some interesting read there. Watch this. This is a typical Dupuytren case of the fifth finger, but then look at the back. You have extensor instability caused by Dupuytren's disease. You're going to see that. So if you don't look for it, you're not going to see it. And you don't want to find that after surgery because then the patient blames you for it. So you want to know that this was present before and be aware that you have to look at both sides of the hand. What I've learned after doing more than 1,000 Dupuytren cases under WALANT is that it works great. It's not the first surgery to do if you were a newbie, but if you're experienced, it's a very comfortable surgery to do. It's a lot of fun, high trust, low complications, and direct feedback. Patients just are smiling and are having fun. They don't have a tourniquet on the arm that presses down. I put the tourniquet on, I just don't use it. I use it as a safety belt, but I never use it, but it's just there so that nurses don't forget to put it on, but I don't use it. It's like your safety belt when you're driving. You don't want to use it. I think it's not just a better technique, it's a better experience for the patients and for us as well. When patients move during surgery, that means the rehab starts right away because they know what they can do. And they're confident, so they're going to be more aggressive with their own therapy because they've seen it. It's in their brain. They've seen it. And they see it before the hand swells also. It's cool because you can also video the surgery and send it to the therapist. I do that all the time. So that guides the therapist to better make their programs and regimens, but also it builds trust because the patient knows that you are in direct communication with the therapist. And the therapist has seen the surgery, and so you get better outcomes. And therapists love that as well. So why do we really do this? I think it's about purpose. Fasting, sedation, disconnection, that takes away control. But when we keep patients awake, informed, and involved, we give something deeper. We restore safety, dignity, voice, because surgery should not just fix the hand. I think it should honor the human behind the hand. WALANT is not just a technique, it's a mindset. It reminds us that words matter, that setting matters, how we welcome patients matters. We're not just correcting hands, we're really rebuilding confidence, autonomy, control, restoring identity. It's not a trend, it's a philosophy. And I think it belongs in every operating room. So I think WALANT allows us to redefine what it means to be a surgeon. We're not fixers. We're there to accompany the patient throughout their healing process. We're there to listen to them. We're there to interact with them. I know a lot of surgeons don't like to interact with patients, but unfortunately, I think a doctor does interact with patients, and that's what we should do. We should honor, we should transform the space between diagnosis and outcome. I don't think that's the end. I think it's the end of the beginning, and it's definitely the beginning of a better way to care. Whether you are redesigning your operating room and you want to make it look like a disco like mine, or if you want to just rethink one habit that you have, maybe write a smiley face on the patient's hand to identify the finger and make them feel good, or whatever it is, I'd love to hear back from you. You can reach me through there. The work is not mine, it's ours, so let's keep pushing forward together. Thank you for being part of that movement. Together, we're not just changing surgery, we're changing how people feel and how we feel too. Remember, we don't treat patients, we treat people. Thank you.
I have just one remark. Maybe it's your Belgian roads that turned surgery into a Tomorrowland experience in you.
Yes.
Have you a question? Yeah.
I have experience as radiation oncologist with cancer survivorship, breast cancer survivorship, any other survivorship, but I haven't ever heard a word about Dupuytren survivorship. We should create it, and you should have your brother, Brutus has Cassius in the classic. So Cassius should be the patient, and the dialogue between you should be the presence. So give the patient a voice, make the hands speaking to us as doctors. That is the mission, and it's the right mission. Congratulations.
Thank you very much. I think that's the beauty of hand surgery, is that we get to interact with our patients a lot, and they use their hands for everything. So actually, hands speak. They do speak.
Very nice presentation. Thank you a lot. Please, do you have only one program for surgery like disco, or you have another for, I don't know, older people?
I'm sorry, can you repeat that again?
You show us that through surgery you have lights and music.
Yes.
It is one kind of music, or you have
several
program of...
No, patients select their music. So what happens is when they come in for the consultation initially, we ask them, so what kind of music do you like? And they're like, what? I said, what kind of music do you like? And they'll say, oh, you know, I like Georges Brassens, I like, whatever. Really, any kind. Céline Dion, you name it. Stromae. I'm in Belgium. And then we write it down in the patient's file. And so when surgery day comes, they show up, and then when they walk into the operating room, the room already looks like what you saw with the light show and the dim lights and all that stuff. And guess what? Stromae's singing. And so when they walk in, they say, oh my God, it's my favorite music. And I'm like, no shit. Really? What a surprise. And so we have tricks like that to create an experience that's unique. Sometimes, and sometimes patients sing too. Yeah, seriously, because they don't wear a mask, number one. And when they're happy, they have no pain, and they're having a good time, they realize, I was scared, and look at this place, it's like Tomorrowland. Sometimes they start singing, or they start tapping their feet. And sometimes we do sing with them. It really depends. Depends the mood you're in. But I want to say a word about the mood. If you design this experience as a show, imagine it's Disney. I mentioned, Magic Kingdom. When you get there, you have to be prepared for a production, for a show. So you have to put yourself in a nice mood. You can't show up there in a bad mood because the experience you're going to provide is going to be crap. And then patients won't come back to you if you don't treat them right. So I think you can, if you want to be happy, stage yourself so that you're happy, your team is happy, your patients are happy, and then you're having a ball. It's really fun. So patients select their music, and all kinds of music is available, thanks to Alexa and other streaming services that we have now.
Just one small remark. In Belgium, we would not be allowed without paying Sabam, but that's another thing. But that's Belgium. Just one more question. Sometimes in my hands, probably I'm slow, surgical procedures in Dupuytren, in complex ones, can take up to 2 hours. And then in the left hand, I was wondering, since part of the hand is awake, if this gives pressure sores or whatever, because I see even in plexus surgery that people start moving after a while because their back is hurting or whatever. Do you use left hand fixation of the hand?
I do not. I don't use lead hand, so no, I've never had that issue.
But if you have these, well, I use the microscope, which is stupid probably, but then if they move, they're out of my sight, actually.
That's why I don't use a microscope. But you're right.
We need another conference.
Yeah, no, I don't. We hold our hands, but they're not held down. They're not.
It's not about winning. It's no fight.
But with a microscope, for sure, they get out of your. I mean, you're going to be out of field for sure. They need to be like completely immobile if you're going to be using a microscope. Otherwise, you're going to get sick.
Yeah, it's all about the fight against Dupuytren, right? Altogether.
Well, I think it's good to have different approaches. The goal is the same. How do we manage a chronic disease by taking the best care possible of the person? And whichever way you do that, I think if you can, if those are the goals, I think we're gravy. Thank you very much.